We also did a long COVID as a separate trial. We did see some very significant benefit. So why did we study oxaloacetate? So this is a molecule in the Krebs cycle. And what drove the decision to move forward is a paper that showed there was a deficiency or a decreased level of oxaloacetate. And it's a fairly critical step in the Krebs cycle. These are some of the things that oxaloacetate can do inside the mitochondria. Oxaloacetate, by virtue of this process, can increase or does increase NAD+ levels. It actually can increase mitochondrial mass, biomass, and it can decrease inflammation by keeping that NF-kappa B out of the nucleus. So another way of looking at some of its efficacy or biochemistry, it's this issue with NAD and NAD+, and changing the directions of these two metabolic pathways. A big deal is the lactate and the lactate level. I remember a study that we did about 10 years ago called the Severely Ill Patient Study. And when we looked at the data, the thing that popped out over and over was elevated lactic acid, lactate. This process can lower that level, and that may be key to a lot of the fatigue and muscle problems that these patients experience, is it can reduce lactate by affecting NAD levels. We did an initial proof of concept trial. There was a significant decrease in fatigue, and we also did a long COVID as a separate trial. We did see some very significant benefit. As a result, a new trial was planned. It's an 80-patient trial. It is a true RCT, placebo-controlled, out of a single center, Bateman Horne. I put this here because I think it's just so dramatic, okay? So this is using a device called Uptime, and I'll show you a picture in a second. So that's the device, and it's worn on the ankle. And basically, it's a way to collect data on how much time a patient spends this way versus either standing or sitting, but with their legs down. We see here, that value is pretty dramatic, okay? This is the difference between time 0 and 4 weeks later after being on oxaloacetate for 4 weeks in the treatment group versus the placebo group. Yes, it's great to have people say they're less fatigued, but that's manifested functionally by seeing them get out of bed and do something, or at least stand more. All right, so this is looking at the results with the fatigue score with Chalder. And again, we see some pretty dramatic results. If you compare the treated patients, there's a very significant decrease in their fatigue levels. Okay, so moving forward, there's a bunch of trials planned or in process. We are starting a long COVID trial with similar design.